Welcome to New York Methodist Hospital. Thanks for joining us today to learn about the advanced health care services we offer women before, during, and after pregnancy. Hundreds of thousands of babies have been born here at New York Methodist Hospital, which is why we've earned the nickname the Baby Hospital. Through this program, you'll meet our staff, tour our facilities, and learn why Brooklyn residents have trusted us with their families for more than 125 years. Chastity and Justin Wilson are about to have their first child and are experiencing a range of emotions.
I found out in August that I was pregnant. I am now 8 months, and we're going to have a little baby boy. And we've come up with the name Jamal Alexander Wilson. I can't wait to meet the little guy. Just totally elated, at the same time a little anxious, just a little. Having a baby is just hard to expect certain things. You can't forecast certain things, and it's hard for me to keep things organized. I don't know what to do. Do I breastfeed? Do I not breastfeed? Do I get a crib? Do I get a bassinet? Should I take the baby to the doctor all the time, or should I try to figure it out on my own? It's just so much to worry about. My doctor was great in guiding me throughout, making sure that I have a healthy baby.
I'll tell you a little bit more about Chastity. I remember the first time I met her, she came with this huge smile, proud to be pregnant. She announced it to everyone that was in the office as if she was the only pregnant lady there, and I knew right away we would hit it off. Hey, Chastity.
Hi, Dr.
How are you?
How you doing?
Hey, Justin.
Good.
Haven't seen you in a while, Justin. Come on inside. Ooh.
Okay.
Belly's getting big,
Yeah.
huh?
Well, when I first found out, I was actually a little shocked. The doctor said, well, you're pregnant, and I kind of stood there like, and then he said, are you okay? And I was like, yes, I'm okay. I just, the first time hearing that when you've never heard it before is kind of a shock. So I was a little scared.
She comes, I reassure her, she feels good about it, and then we talk about other things, and I know that I'm going to see her again in a few weeks, and then my job will be to reassure her one more time.
He's a great doctor. Any question that I had, he was able to answer it, without any doubt.
And now what do you mean by you said that it's getting tight sometimes?
Yes.
How often does that happen?
Not often.
Okay.
Sensitivity is the most important part when you're having a baby. You're going through all these wide range of hormones and emotions, and you just need someone there who can understand.
As soon as I walk in, there's just that smile, and our eyes connect, and she has that feeling, my doctor has arrived, and everything is going to be okay now. It really takes 9 months to build that relationship, but it's really worth the 9 months.
Frequent prenatal visits to assess your baby's development are crucial. Our obstetrics care includes comprehensive screenings that monitor your baby's health and allows you and your partner to form a close bond with your baby even before he or she arrives. Hearing your baby's heartbeat is a special moment on your journey to parenthood, but this trip begins much earlier with regular visits to your doctor, good nutrition, and management of any pre-pregnancy health issues such as diabetes and high blood pressure.
So when she asks a lot of questions, it kind of helps us to build out the rapport. And then when the patient comes in labor, we know each other. We know each other very well. I know what's on her mind. She knows what I've been thinking. And then it's like the team coming together for the final act.
Our obstetricians deliver over 5,000 babies each year and are trained to listen to your needs while handling any situation that might arise.
And when they ask me if a patient can deliver at home, yes, most babies can be delivered at home. However, you want to deliver in a hospital, because if there is something that's, a little bit unique about your pregnancy, we have an entire hospital ready to back it up.
Oh, okay, look at his face.
Okay. Oh, look at that. It's a beautiful picture. Justin, press that button. You see what says freeze? Yeah. Okay, great. I'm going to make you a copy of that, okay?
There is a tradition. When we ask around here, and where were they born? They were born at Methodist. I'm talking people that are 60, 70, 80 years old. And so it has a long history of being a baby hospital. I think we're upholding that.
That's his face. That's his eye. He's looking right up. He's looking straight at you.
Oh, okay.
Okay, you can really see a lot. You have to use your imagination a little bit. But he looks just like Justin.
Okay.
Seeing your baby is a joyous occasion, but to accommodate all the imaging needs of women, New York Methodist Hospital established the Advanced Women's Imaging and Prenatal Testing Center. Here, all the imaging is done quickly and accurately. Dr. Hotz explains.
The idea behind the name Advanced Women's Imaging is that in one center, we'll do both female pelvic imaging for pregnant patients and also for women who are not pregnant. And in the same center, you can have your mammogram and your bone densitometry. And you don't have to have 3 separate appointments on 3 separate dates. You have all of your tests done in one center on the same day. We have a team of both obstetricians and radiologists working together. So the radiologist will read the mammogram and the bone densitometry, and myself and my partners will read all of the femoral pelvic imaging. So if somebody who does general imaging will see a couple of cases a day, we see 50, 60, 80 patients a day with similar kinds of problems, so that gives us a broader scope.
And thanks to one central reporting system, your doctor usually receives test results within 12 hours of your visit.
And this is a last generation equipment which obviously has abdominal capabilities, transvaginal capabilities. So actually, as you can see here, this is just surface rendering of a fetal face, and you can see it actually in real time. What's really exciting is now we can not only see surface imaging, but we can see in 3D within the fetal body. In all of the rooms, it's connected to a monitor, so as we're scanning, the patient sees the same thing that I'm seeing.
Choosing whom to trust with your baby's entrance into the world is an important decision. Naturally, moms and dads are concerned about selecting the right doctor and place to deliver their baby.
There's more of a personal sense. You get a one-on-one with the doctors and the nurses, and they're there to help you 24/7, and you just feel more secure with someone that you can talk to. I'm really confident in this hospital.
Okay.
Right now, things are looking very good.
Good.
Okay, Chastity, it's a pleasure to see you. Okay?
Likewise, Dr.
Let me give you
Ryan.
a picture.
To help you prepare for the big day, we have developed classes, tours, and instructional services to familiarize you with the facilities and people at New York Methodist Hospital. One of the first things we encourage expectant parents to do is to take a 1-hour tour of our labor and delivery and mother-baby units. The tour is conducted weekly by a trained guide who will explain what to expect during your hospital stay. Members of our staff are also on hand to answer your questions.
If you go to see the labor and delivery rooms at Methodist, they're amazing. They're mahogany furniture and nice television. It's immaculately clean, and there's tons of staff. You're never left alone for a second.
On the labor and delivery suite, we take a team approach, and we have the attending physician, your doctor if he's there, the 2 doctors that are overseeing the entire floor, the resident, the nurse, the anesthesiologist who is there also all of the time on labor and delivery, sometimes the social worker, and the neonatologist also come. It's a team. We go around and we make rounds 2 or 3 times a day from room to room, talking to the patient, discussing their status, their progress, their complications. And the patient sees that this team is all talking to her. This is all about her. And I think that's a great approach.
I live in Manhattan, and I chose to have my children here. My friends, after they heard my experience, came from Manhattan to have their babies here. It's the kind of place where you walk down the hallways and everybody stops to see how you are. The staff is actually friendly and friends with each other. Nursery nurses are so experienced. They've been here, some of them 20, 30 years. They never leave, and I think that's something to be said. We find that it's so rare.
What we try to do is make the birth process a homey experience. We try to maintain the same nursing care throughout the patient's labor so that she gets comfortable with her nurse who's going to be there for her labor and for her delivery. And frequently we have patients who return and ask for the same nurse that they may have had with a previous delivery.